Hello, I'm Dr. Jill Morris of World Class Dentistry and of Self-Realized Living. In today's video, we're going to talk about implants and how you clean and take care of your implants once you've received them. An implant is not a tooth, it is a medical device. So it is a screw. It can either be metal-free and ceramic, called zirconia, like you see here, or it can be titanium, which is metal, like what they use for hip replacements and knee replacements. But you'll notice that it is a very thin screw in size compared to the crown. So it's almost like having a marble on top of this little screw. If this were a tooth, you'd have a root about the same width as the crown. And so because of that, you will get more food and things like that around implants. So there is a pandemic today really with implant loss. Probably I hear numbers anywhere from 20% of implants are being lost and rejected from patients today, all the way up to 60%. So we are seeing quite a few people lose their implants due to bone loss. So Harvard has done a study, and in that study they would resect and biopsy these implants and the tissue around the implants to try to figure out why they were failing. A lot of it was poor home care. You can get gum disease around implants. I've had patients come in and they say, I want to get rid of my teeth. They're nothing but trouble my whole life and I want to get implants. And they think that that's it, that they'll never have to worry again. But if 60% of implants are being lost, or 50 or 40, whatever the number may be, you can have problems with your implants. So Harvard also found microscopic pieces of floss around the implants. And because it is a medical device with all these screw threads, the floss would get stuck and shredded on these threads and people wouldn't know it. You couldn't see it. And it would wick in the bacteria, and that would cause the bone loss and the loss of the implant. So home care is extremely important, how you do it. We recommend to our patients, do not floss. You are always going to get more food around implants. So the teeth around implants have a higher risk of decaying also because of the tendency to get food there. So you can overcome that by water picking, and you can use your normal water pick tip here, and you just go right around the gum line with your water pick. You also want to use your electric brush, and you want to brush at the gum line. And I recommend watching my other video about how to brush your teeth properly, and that goes with implants as well. For our patients that have the bridges that are connected to the implants, like this that you're seeing, the bridge goes in, it does not come in or out. But if you notice here, there's a lot of material that food can build up on underneath the bridge if you don't clean it properly. And you can get bad breath, and it can cause loss of implants. So with this, you also need to really water pick. And they've come up with this new water pick tip that's like a hook, as you can see here. And so this hook can get up high under the lip, and you just go right along the tissue, squirting the water under your appliance and your bridge, and then the same thing inside, just squirting the water under that bridge. And you do that every day. And remember, get your head down over the sink and get this in your mouth before you turn the water pick on so you don't make a mess. So water picking and brushing with your implants only. We do not recommend flossing for that reason. Another thing about implants is they are solid in bone, and because of that, they don't go along with the natural drift of teeth in the mouth. So over our lifetime, we have something called forward face movement, where the teeth actually gradually move forward and shift around implants. So many times an implant can go in, and then a couple years later a space will open up because the natural teeth have drifted. And so you don't want those spaces. Food will get in there, and it will cause decay of the other tooth, the natural tooth, and also you'll have a hard time cleaning around the implant. So we recommend to our implant patients that they wear a retainer, like an Invisalign retainer, to keep from getting that drift of the teeth over time that opens up these spaces around implants. So that's basically the care of the implants. Some of my other videos, we do have a tray system that kills bacteria that I'll talk about, and also a probiotic for the mouth. But I'll talk about that in another video. I'm trying to keep the video short for you all. So that's how we take care of implants. Thank you.